principles of public health is going to be our discussion. For those of you who might not know me, I'm called Mawa Bosco. I guess some of you are meeting me for the first time, but those are my names. I'm the founder of Bristol University. So we are going to talk about public health, and in this session, we're going to look at the definition of public health, the key principles of public health, and then the roles of public health professionals, the historical development of public health, and then a little bit on the concepts of disease prevention. Okay, so public health is a discipline that can be defined as a science and an art of promoting and protecting the health of communities and populations. I've chosen this simple definition. One, because it carries the key elements of public health as a profession. As a profession, public health relies on scientific evidence or scientific knowledge or scientific research, so therefore it is a science. And then it also requires skills, so it's therefore an art of promoting and protecting the health of communities and populations. The word population is very important because it distinguishes public health from clinical disciplines, where the focus is on an individual patient who comes and to see a clinician or a physician. Public health, the focus is on populations, and when we talk about populations, we are referring to people who are sharing a specific characteristic. It could be that they are living in the same geographical area, or it could be that they have a characteristic that they share. So we can say, for example, blacks, that is a population. We can say prostitutes or sex workers. Those are populations, okay? But they may not necessarily be coming from the same geographical location. Okay, so that is basically public health. It focuses on improving the health outcomes of populations. And the populations can be those people who are staying in the same geographical area, or those people who share a particular characteristic. It differs from clinical courses or disciplines because its focus is basically on populations. So in public health, there are a lot of things that public health professionals do. They prevent diseases, so they implement interventions that are aimed at preventing diseases. They promote health, okay, by enabling populations or individuals to adopt healthy behaviors. They also protect populations against diseases by carrying out interventions such as vaccination and also eliminating or regulating environmental exposures. They also health educate communities and population about diseases or risks happening. They promote universal access to healthcare resources. That is what we call ensuring that everyone has an equal access to healthcare resources and healthcare services. That is what we call health equity. They also prepare for emergencies, such as preparing for example, what we had with COVID-19. Preparation for such emergencies is very important, and it is one of the objectives of public health. Monitoring what is happening within communities and populations in regards to health matters, what we are referring to as surveillance and monitoring, is a key objective of public health. Public health professionals also enact policies that promote health. Issues to do with ensuring that you do not drive when you have not put on your seatbelt, issues of ensuring that you don't drive when you're drunk, issues of not allowing young children to take alcohol, to be exposed to everyone to be exposed to environmental toxins. All these policies that are enacted by public health professionals. In enacting policies or even in designing and implementing public health interventions, public health professionals engage the communities, because the communities are very important. They are very resourceful, and if public health professionals engage them, it allows the communities to own the projects, and this allows for sustainability, but also it allows them to be able to participate in decision making. Of course, I've talked about environmental exposures which can impact health. It's the role of public health professionals to ensure that these exposures are eliminated, or there are procedures or policies or measures to mitigate the impact of health of environmental exposures on health. Public health professionals ensure that everyone is actually having the optimal health outcomes, and this also includes people who may be vulnerable to adverse health outcomes, and these can include children and also mothers. So an element of maternal and child health is very important in public health. Increasingly, we are having a shift in the burden of disease, where we have non-communicable diseases increasing in even developing countries, and therefore the focus of public health these days is to ensure that there are mechanisms to prevent to prevent non-communicable diseases, or what we are referring to as chronic diseases. Public health professionals engage in research that is used to provide evidence for ensuring that evidence-based practices are implemented. And then the other aspect is that public health involves in collaboration with other stakeholders or with other partners to ensure that public health problems that transcend through borders are mitigated. So it means that we need to work with other actors from other countries across the border to mitigate these problems, and this is an aspect of global health. And then the other aspect is making sure that the health systems are resilient and robust. So this means that health system improvement is one of the key roles of public health professionals, and therefore we can say that when you graduate as a public health professional, you should be able to work in all areas that we have hinted on in our objectives, whether it is research, whether it is global health, whether it is environmental health, whether it is health education, whether it is health promotion, any area, you should be able to fit in. So what are the key subjects that you really need to understand and even study? The core subjects of the public health include epidemiology, which is basically concerned with studying the pattern and distribution of health-related conditions or health-related events or states in populations, and taking measures to be able to control the health problems. That is epidemiology. It is one of the major disciplines of public health. The second one is about biostatistics. Biostatistics is concerned with collecting uh, analyzing, and then interpreting data about uh, health, health data. Okay, so that is a discipline of biostatistics. Is another key discipline of public health. And then behavior and social sciences. This discipline deals with how social factors influence health, and how do we make sure that people adopt health behavior. So we look at how behaviors influence health, how social factors influence health, and how people can be able to change their behaviors um, to adopt healthy behaviors. Okay, so we look at theories and models of behavior change. So it means that behavioral sciences are very, very important in health promotion. And then we move to environmental health, where we look at environmental factors that influence health and how these factors cause cause health hazards or health effects. So what are those mechanisms, and how do we mitigate against environmental exposures? And then health management and policy. This is the discipline that is concerned with making sure that resources, health resources, or human resources, or what we call human resources for health, are optimally utilized. So we look at um, um financial resources, we look at human resources, we look at equipment. All these are what we can generally term as health resources. So how they are managed, and what policies and do we need to enact to make sure that we actually optimally use these resources, but also what policies um, need to be put in place to ensure that populations have optimal health outcomes. So those are the 5 major disciplines of public health. These are the things that you really need to master in public health. So if you master these subjects, it means that you acquire these competences. So what are these competences? When we talk about competences, we are basically referring to knowledge, skills, and attitudes. These 3 elements constitute what you call competences. So for you to be a very competent public health professional, you need to be able to do the following. 1, you should have knowledge in public health sciences. And the major public health sciences are the ones that we have listed in the previous slide. Okay, you should have knowledge in these principles, because they are the ones that guide the interventions and the other activities of public health. You should be very good at analysis. This is to mean that you should be good at interpreting data, but not only interpreting data, collecting the right data, ensuring that you can analyze the data, and then make interpretation. The interpretation is very important for making decisions in public health. The other thing is, of course, you should know the dynamics of policy formulation, implementation, and evaluation, and how you can actually plan an intervention. Those are very, very important. And then you should know that you're going to work with different people. So you should be a person who is inclusive, who can work with people from other cultural diversities. So diversity and inclusiveness are very important competences of a public health professional. And then we look at leadership. Of course, you need to mobilize people, you need to look ahead, you need to make sure that there is a vision that you portray and people can be able to follow you. So these are leadership skills that you actually need. You need team leadership, you need proper decision-making skills, you need strategic management. Communication is a competence that is required by almost all professionals. So you need to be very good at coding messages. You should be very good at decoding messages. You should be very good at whether written messages, written communication, good at non-verbal communication, good at public speaking, good at media relations, managing social media, creating awareness. These are all things that are related to communication. In public health, we don't work alone. In one of the definitions of public health, there is an element to do with community efforts. Okay, when we say that public health is a science and an art of promoting health, preventing diseases in communities and populations with community efforts. That community efforts refers to the fact that we need to collaborate with communities. We need to work in partnerships with other organizations, and we also need to advocate. So partnerships, collaborations, and advocacy are key principles of public health. So we have seen that public health touches different areas of disease prevention, areas of health promotion, areas of policy, areas of research, and areas of ensuring that everyone has equal access to healthcare resources. And this will eliminate what we call health disparities. Health disparities is a concept that relates to the fact that you can have other people or individuals within a particular community or population that may have poor health outcomes. Okay, and that means that we don't have what you call health equity. Okay, the poor health outcomes may be because these are people who have been neglected, marginalized. So we don't want that to happen. So public health covers all those areas. Areas that we can say that areas that influence health states. Okay, so public health looks at communicable diseases, non-communicable diseases. We look at mental health. We look at issues to do with the environment that influence health. We look at a number of areas. We look at bioterrorism. We look at we can also look at health in a digital dimension. Okay, we can also look at public health in a dimension of entrepreneurship, what we call public health entrepreneurship. So public health touches a number of areas. So let's look at the history of public health. It's very difficult for me to really give the comprehensive history of public health in this presentation. However, the key things that you really need to note are, one, that the history of public health is related to how humans used to understand what causes diseases. Okay, therefore, in ancient times, there was a recognition that the environment plays an important role in causing diseases, and therefore, the emphasis by then was on ensuring that the environment is clean. So issues to do with clean water and sanitation, and ensuring that food is of good quality. Okay, that was during the ancient civilization. And then, of course, as civilization started to come in, people started to realize that they realized the connection between the environment and the diseases that were really happening. And this is where issues to do with sewage systems were put in place. And then in the Middle Ages, people believed that conditions can be conditions can be transmitted from one person to the other, contagious conditions, and therefore isolation or quarantine measures were actually being implemented. But this can be regarded as what we call rudimentary quarantine measures, because some of these diseases were not actually contagious. Okay, and then as we moved on, issues to make sure that all people have equal rights to be healthy, and issues to do with making sure that the government actually has a role in safeguarding everyone in terms of maintaining and protecting health. Okay, so that meant that there are debates on whether the government should actually be involved or really not. That was the Enlightenment age. And then in the 19th century, John Snow, a physician in England, pioneered work in epidemiology and is regarded as the founder of epidemiology. What he did was that he discovered the connection between cholera and a contaminated water company or water source. And then he did a lot of mapping to see the pattern of the people who are dying of cholera and where they really came from. Okay, and that is the foundation, or it is the basis of much of the epidemiological work that we even do up to today. And then I had not mentioned about what we call the miasma theory, which actually believed that people got diseases because of vapor that comes from the environment, basically the filthy environment or the filthy environment. And this theory was people believed in this theory basically, and during the time when the germ theory was not in place. Okay, issues to do with the fact that germs can cause diseases were not really accepted before or during the time when the miasma theory was actually in place. So individuals such as Louis Pasteur, Koch, these people played a very important role in ensuring that people actually understand that diseases are actually caused by microorganisms. And then we moved to another key development where a smallpox vaccine was actually introduced through an experiment which you can regard as an ethical experiment, where Jenner tested or inoculated a young child with chicken pox. With the smallpox as a vaccine for chicken pox. Okay, but consequently, of course, other developments or achievements such as the development of antibiotics played an important role, and then consequently different organizations that created to spearhead public health started to emerge. Okay, in different countries, in UK and also in the US. Okay, so organizations such as the CDC and also WHO and others were formed during that time. So as you can see, that much of the history about public health is concerned with communicable diseases. But over time, the shift is now, for example, in the 21st century, it is on non-communicable diseases. So basically having what we call a double burden of disease, where countries developing countries still experience a huge burden of communicable diseases, but at the same time, we are having a lot of non-communicable diseases happening. Okay, so, and now the emphasis is on prevention and health promotion. So that is basically the brief history of public health. When we talk about public health system, we basically refer to the organizations involved in public health activities. This can be public agencies, whether at the state level, whether the county level, whether the local level, whether it is the NGOs or other international agencies. So all these, the totality of these institutions is what we call public health system. So these actually work to make sure that they achieve the objectives of public health. Private sector organizations or private institutions also work in public health through either research or even education, but they can also work through with government through what we call public-private partnerships, PPP or triple P. So when we talk about public health initiatives, we basically talk about all these campaigns and interventions to prevent diseases, to promote health. They can be health education campaigns, they can be campaigns to strengthen the health system. The key thing here is there's need to have investment in public health in order to realize the improved health outcomes. So it is very, very important. Unfortunately, in low-income countries, we have low investment in public health. Okay, and therefore we have limited infrastructure, few health workers, and therefore poor health outcomes. And we rely a lot on donors or aid. Okay, so in the field of public health, international partnerships to make sure that we solve these problems, it actually becomes very, very important in the context of having limited resources in developing countries. So when we talk about the public health approach, we basically talk about we mean the manner in which public health problems can be handled. Okay, the first step is assessment, the second is policy development, and then the third is assurance. You need to understand the health problem you're dealing with, and that is assessment. So you need to understand what is really happening. So you answer the questions on what problem is there, who is being affected by the problem, and where. That is descriptive. And then you also look at how are these health problems related to other factors, or societal factors, cultural factors, political factors, structural factors. So you arrive at the answers to those questions by carrying out an assessment where you collect and analyze data about the health problem that you're dealing with. Or if you really don't know the health problems affecting the population, then you need to carry out a comprehensive health assessment of the population, and that is when you come up with the health status of the population. And then the next step was, of course, designing interventions that will be used to address the health problems that you have identified. So that means that you really need to look at issues to do with collaborating with other key stakeholders, policymakers, and experts, such that you really design an appropriate or effective health program. And then the next step is basically what we call assurance. This is basically M and E. You need to make sure that the resources that you are putting to this intervention are actually optimally used. So you monitor and you enforce compliance with the standards that we have set for any given intervention. When we talk about public health ethics, we basically refer to the fact that when we have, uh, when we are interested with public health resources to design the appropriate programs or to carry out any public health intervention, we need to do the right thing. And that right thing depends on certain principles that we really have to follow. So public health principles are very, very, very important. Uh, um, Public health ethical principles are very, very important in enabling us to make the right decisions. Okay, so which principles are those? Of course, the usual principles of health ethics apply. Beneficiency, that is making sure that you do the right thing, making sure that you don't do anything harmful to the population, that is non-malefficiency, justice, ensuring that everyone is treated equally with no discrimination, whether based on tribe, gender, or any other characteristic. And then you can also have issues to do with confidentiality. Okay, confidentiality is very important. Issues to do with the consent are also very important. So those are the public health ethical principles that we follow in making decisions. However, we also use what we call ethical theories to arrive at the right decision. So we are not going to look at these ethical theories, but we have the utilitarian theory, the deontological theory, okay, the virtue ethics. These are things that we really follow in making decisions that perhaps you can get time and read about. But because of the nature of public health, sometimes we make decisions that actually appear to be controversial. So we often say that public health is a controversial display. So what are these controversies? One is that from an economic standpoint, you want to make sure that resources are allocated to public health interventions that will result into positive health outcomes. However, there are economists who argue that when you put resources to public health programs, it can negatively impact on economic growth. Okay, partly because sometimes some of the public health interventions may not be really directly translated into monetary benefit. Okay, so some economics may argue that investing money in public health interventions will not give you the rewards that you want in an instant. And then other people also contend that public health measures, such as making sure that people don't smoke, such as making sure that people don't take beverages, these limitations to alcohol, to cigarettes, even these sweetened beverages, may be looked at as interventions or as measures that limit business operations, and this can cause what we call economic concerns. Someone who looks at profits in their companies that are related to these industries may look at you, or a politician may look at you as a person who does not want the revenues or the taxes to come in, because you have a lot of taxes that you get from alcohol, a lot of taxes that you get from the tobacco industry. So if you limit, then that means that you're damaging the economy in the other way. And then the other aspect, which I actually explained earlier on, which is that the cost that you put, the resources, the financial resources that you put in a public health intervention may not produce the benefits that can be equated into a monetary value. So some people will question whether investment in public health is actually worth it, or it is actually justified. That's the point of cost-benefit analysis. Then we move to another standpoint, which is the libertarian, um, or the right standpoint, which is one is basically on the basis that you don't want to, we don't want the government to be involved in how people really behave. People should have their rights and freedoms. Okay, so we don't want mandatory vaccinations, for example. We don't want to be forced to put to wear seat belts because you're infringing on my rights and freedoms. That is that view, the libertarian stand view. So when you have the government saying every child under the age of 5 should be vaccinated, it means that the government is actually uh, not allowing people to make their own choices. So it's basically infringing on their rights and freedoms on issues that are actually personal in nature. So this view is that the government should not be concerned a lot in matters that are personal in nature. So therefore should not infringe on individual rights and freedoms. And then we have another standpoint, the religious standpoint, that some of the public health interventions may actually be against religious beliefs and practices. Okay? And this may lead to immunizations. Some religions and beliefs may or actually are hesitant about immunization. They don't believe in immunization. Yet in public health, we say immunization are one of the potent ways in which health outcomes can actually be improved. And then we have issues to do with end of life care. It is if a patient is having a terminal illness, and we know that this patient is going to die, what is the best course of action to do? Should we continue sustaining their life, or the physician should perform what we call a physician assisted suicide? So these are the very difficult questions that have to be made. And different countries have different policies or laws regarding these elements. Another point that makes public health very controversial is an issue to do with how resources are actually shared. If, for example, you are in a crisis and you have limited resources, how are you going to make sure that you share these resources? That's an element to do with rationing. So, for example, we had COVID-19. We had in some countries where because of the limited space, people who had highest chances of surviving were the ones who were actually being attended to, and those who had limited chances of surviving were left to die. This was an element to do with resource allocation. Okay, so of course, what happened in some of these countries, for example in Italy, was that the elderly women or the elderly people were not attended to, and those who posed or who had better chances of survival were given the care that they needed. Okay, so we have different ways of navigating these issues. So we have a number of ethical frameworks that can be used in sharing or in decision making in regards to resources. Of course, because of the different perspectives or values that different people actually have, of course, disagreements will always emerge. Disagreements on reproductive health services, where we have elements to do with legalizing abortion or not, making contraception available or not. These are issues that have disagreements, that public health professionals have disagreements over and over again. Now, we look at what we call political economy of public health. In our previous slides, we have looked at the connection between public health and government. And we have seen that there are people who say the government should not really be enforcing laws or practices on people. People should make their own independent choices. So that means there is a connection between politics and public health. So we are going to look at these connections. So the first one we're going to look at is what we call neoliberalism. This is a thinking or a political ideology that advocates for limited government intervention in markets, and it advocates for also privatizing public services, deregulation, and the focus on individual responsibility. This is basically to say that the government should not, if the cost of, let us say, the cost of getting healthcare services should be determined by forces of demand and supply, and the government should not really interfere. If you go to a given health facility and they give you paracetamol 10,000, and you shouldn't make noise over it, and the government should not come in to reduce the price of paracetamol. Okay, this is the neoliberalism ideology. And then the other element is that the government should not even be the one offering the services to the people, the health services to the people. The government should work with the other entities, other organizations, either in the private sector, so that the other entities are the ones who provide the health services on behalf of the government. That is privatization. Okay, and then the regulations should not be too much. That's the element of deregulation, and that everyone should really care for themselves. That is individual responsibility. So that is the thinking in neoliberalism. And then we move to the element of globalization, which is that the countries are actually interconnected. We have what we call externalities. An event somewhere else may have a health impact on another party who is not actually part of that event. So that is what we call externality. So because of globalization, we can face negative and positive externalities. When a discovery for a drug that treats a given condition in the US, it's most likely that with time that drug can actually reach South Sudan. So that means an activity in the US can have an impact in South Sudan. Okay, that is the positive externality. But we can also have an element of a negative externality, where we had COVID in China affecting the whole world. That's what we call a negative externality. So globalization allows us to exchange goods and services using technology, and on a scale that is actually very rapid. But this interconnection can have both positive and negative health implications. And it is therefore very important that we realize that what happens in other countries can have impact in our country as far as public health is concerned. Now we look at what we call ethics, politics, and ideologies. We already looked at issues to do with ethics, which is basically the study of what is right and what is wrong. That is ethics. When it comes to politics, it relates to how a given nation or a sovereign country is actually governed. And then when it comes to what you call ideologies, this is basically the way in which people perceive, or the way in which people want to be ruled, okay, or the way in which a given class or a given party wants to rule a given nation. So the decisions that are made by that ruling group is dependent on their ideology. Okay, so for example, the SPLM has their own ideology of how they want to do their things. Okay, that is what you call ideology. So what is the connection between political ideology and public health, and also what you call power dynamics? Okay, there are people who think, or there are political ideologies that think that the government is responsible for providing everything that the citizens want. That is an ideology. And then we have an ideology where um, the thinking is that the government should play a limited role in how people live their lives. Okay, whether it is in the economy, whether it is in the education sector, whether it is in health, it is a free economy. Okay, so those are the different ways of thinking about how people should be governed. Now, how public health comes in is that public health professionals will face a lot of dilemmas depending on which ideology the ruling class or a given territory is being governed. So you'll have issues where, if the ideology is that the government should have limited interference with individual rights, then issues of instituting, for example, mandatory quarantine become very difficult. Mandatory vaccinations become very difficult. So these ideologies make the practice of public health different in different areas, depending on which the nature of government that we have and what role does that government have in public health. So we move to what we call new and old public health. The distinction is basically very simple. The old public health, what we call the traditional public health, its focus was on primarily communicable diseases. And that if you make the environment good, you have good water, good quality water, safe food, the air is okay, that is public health, and that is that. The public health that we practice in this generation, the 21st generation, is what you call the new public health. You can also call it contemporary public health. It looks at going beyond the communicable disease. It places the role of communities and at the forefront. It places the role, the problem of non-communicable disease at the forefront. Okay, so the other thing is that emphasis is more on prevention and promotion of health in what we call the new public health. So the things that are really happening in public health are that, one, that the emphasis is now on using new public health approaches, where we have partnerships and collaborations and engaging the communities as being paramount, looking at the non-communicable diseases on top of the communicable diseases, and then also looking at the social determinants of health as one of the major frameworks, and then advocating for policy changes to promote health. And then we have explained the importance of globalization in regards to public health. So it means that the public health that we actually practice now should be one that promotes cross-border collaborations and partnerships. We need to work together because we are actually interconnected as the globe. And then, of course, the use of technology and data-driven decision making is becoming very, very, very common, where the application, public health surveillance, telemedicine, information management is very important. So thank you for listening. That is the first session. If you have any questions,